Hello. Today I'm going to talk to you about complementary and alternative medicine in GI and illnesses. My name is Anthony Lembo, and I'm a professor of medicine at Harvard Medical School and director of the GI Motility and Functional Bowel Disease Center at the Beth Israel Deaconess Medical Center in Boston, Massachusetts. We know that complementary and alternative medicine is commonly used in the United States. In fact, previous studies have shown that about 35% of the adult population in the US have used CAM therapy over the past year. What's most interesting, though, is that about 50% of people do not tell their doctors about their use of CAM therapies. The people that are more likely to use CAM therapy in the United States are particularly more common in younger people than in older people, women more so than men, those with higher education, those with more severe symptoms, and those that report poorer satisfaction with standard therapy. Now, there are a number of different types of complementary and alternative medicine. This slide lists just some of the more common ones that are being used for GI disorders. And we'll be talking about some of these in the upcoming talk. You can see this includes acupuncture, herbal treatments or medications, and these are generally considered to be non-vitamin, non-mineral supplements. These include things like ginger, peppermint oil, or probiotics or digestive enzymes. Mind-body therapies such as hypnosis, cognitive behavioral therapy, biofeedback, meditation, yoga, and Tai Chi are all common types of mind-body therapies. And then there's manipulative therapy type therapies. These include yoga, which kind of overlaps with mind-body, chiropractic or osteopathic manipulation, massage, and craniofacial therapies. Now, this slide comes from a study that we conducted a few years ago, and it looks at CAM use in U.S. adults with GI and non-GI conditions. Let me just walk you through the study a little bit. First, on the left-hand side, it looks at the type of CAM therapies that we included in this study. And you can see it's many of the ones we just talked about, but the specific ones are shown on the left. And one specific type of CAM therapy that we included was special diets. And I think more recently, diets have gone more into mainstream medicine. So we're actually not going to talk about diet therapies in the following slides, but we did include it in this study that we did a few years ago. And if you look at the graph, on the far left of the graph shows you people that reported having no GI conditions. The black showing people that do not use CAM therapies. And you can see that about 70% of people without GI conditions do not use any CAM therapy. But that means about 30% did. In the different shades of gray, go from those that used 1, 2, 3, 4, or 5 different CAM therapies, again, over the past year. And this is in contrast to the middle graph, the middle bar, when this shows the use of CAM therapy in people that reported having any GI condition. Now you can see that over 50% of people said they did not use any CAM therapy, which meant that more than 40% of people with GI conditions actually used CAM therapy, which is more than those without GI conditions. And shown on the far right are those that used CAM therapy for at least one GI condition. What this shows is that many people are using more than one type of CAM therapy in order to treat their condition. So we also asked individuals what were the reasons for and the perceived benefits of CAM therapy for their GI conditions. And this is quite interesting. This just shows you the reasons for why they would use it. Again, people wanted to feel well, just general wellness and disease prevention was the most common. They felt that it was natural. That was the second most common, that it could be practiced or done on your own. You didn't need to see a doctor or get a prescription. And many people felt that it treated the cause and not just the symptoms of their condition. And they felt that the therapy and plus the CAM therapy plus medical treatment together would be helpful. And many people use it for improving immune function, improving energy, focusing on the whole person, mind, body, and spirit. And And you can see the other reasons, which are a little less common, that medical treatments don't work for their health problems, or they develop side effects or memory or concentration issues with the reasons why they're taking CAM. So thank you very much for your time and appreciate your attending.